beautiful. Thank you. So pleased we remembered. Giving everybody the heads up that we're recording this session for folks that aren't able to make it today, or for anybody who wants to refer back to it at a later date. But it is 1:02, so I think we'll still have some people filtering through, but I think let's get started because we have a full agenda today and we want to leave plenty of time for folks to ask questions. Just orienting ourselves, this is the informational webinar for the REACH PA grant. This grant is a partnership between Vital Strategies and the Scattergood Foundation. And we're going to introduce ourselves here if you want to advance to the next slide. So we're going to start with some intros. We're going to do an overview of the RFP. We're also going to provide some project examples. I think sometimes it's helpful to make something like this RFP a little bit more concrete and talk about some projects that we've done in Philadelphia and some other states. And then Scattergood is going to take on the reporting and the participation expectations. They're also going to do a walkthrough of Founded, the grants portal, and then we're going to leave plenty of time for Q&A. Next slide. So we'll start with doing a little introduction of Vital Strategies. My name is Zoe Soslow. I'm the technical advisor leading Vital Strategies overdose prevention work in Pennsylvania. And Dana?
I'm Dana Kurzer-Yashin. I like the pronoun she and her, and I work with Zoe on the Pennsylvania team.
And Vital Strategies is a global public health nonprofit working for a world where everyone everywhere is protected by equitable and effective public health systems. We have an overdose prevention program that works in 7 U.S. states, with Pennsylvania and Michigan being the first 2 states that we began work in. We are both a technical assistance provider and a funder with support from Bloomberg Philanthropies. We also have evaluation support from Johns Hopkins. And we have had multiple RFPs focused around racial equity in Philadelphia County, in New Jersey, and in Michigan. I'm going to pass it over, next slide, to Scattergood to introduce themselves and their organization.
Hi, everyone. I'm Caitlin O'Brien. I'm the Director of Learning and Community Impact at the Scattergood Foundation. And I will first pass it over to my colleague, Bridget Talone, to introduce herself.
Hi, everyone. I'm Bridget Talone. I'm the grants manager at Scattergood, and I will pass to my colleague, Allie Ferguson.
Hi, I'm Allie Ferguson. I'm the Chief Operating Officer at the Scattergood Foundation, and I will not be speaking throughout the session today, but I will just want to reiterate that we are here to help answer any questions you may have throughout the process. So please feel free to reach out early, often, and get in touch with us. And I know our contact information will be shared towards the end, but just want to really make sure everyone knows that the line of communications is open, and we're looking forward to this opportunity.
Thanks so much, Allie. So the Scattergood Foundation is a philanthropic organization based in Philadelphia that believes major disruption is needed to build a stronger, more effective, compassionate, and inclusive society where behavioral health is central. We see our work in 3 buckets: think, do, and support. So think, we curate thought leadership from leading experts and put out policy papers and things like that to try to advance the field from a more systemic approach. And then our do work is really our technical assistance, capacity building work that is focused in a few different areas, but has largely focused on building capacity for evaluation and measuring outcomes and communicating impact. And then finally, our support work, which is really where this opportunity falls, is our grant making. So we have several different buckets of grant making. This is one of our special grant programs that we are thrilled to be partnering with Vital Strategies on.
All right, I think you can go to the next slide. So we're just going to give a little bit of background on REACH PA. So it is a statewide grant opportunity aimed at supporting community-based organizations to adopt and grow a harm reduction philosophy and practice. So this is an effort to address the overdose crisis in our state. prioritizing resources for Black, Indigenous, and Hispanic Pennsylvanians. As I mentioned before, REACH is a partnership between Vital Strategies and Scattergood Foundation. Vital Strategies is funding the work, and Scattergood will be acting as the grants administrator, meaning that they will be leading the selection process, acting as the main point of contact, technical advisor, and providing support for the selected subgrantees. We can move to the next slide. So eligibility, I know there's a lot of questions about this. I'm going to give an overview and then we can open it up in the Q&A as well. To be clear, you do not need to be a 501c3 to apply for this opportunity. We will consider folks with a fiscal sponsor. It's also not totally necessary though. So what we would say is that if you don't have a fiscal sponsor or if you're not a 501c3, please reach out to the contact emails and we can talk about it and see what we're able to do. We're looking for organizations that are led by Black, Indigenous, or people of color. We will consider partnerships between organizations, but we're looking for organizations with BIPOC leadership. So we want to make sure that it's not just a community advisory board. But again, feel free to reach out to us if you have questions or open it up in the Q&A. We are open to applications statewide, meaning that yes, we are accepting applications from Philadelphia, but we are also prioritizing applications from other parts of the state. We want to be sure to hit on rural areas. But again, please don't hesitate to apply if you're in Philadelphia County. We want to see a geographically diverse grouping of applications, but we certainly understand the extreme need and the vulnerability in Philadelphia as well. We want to see organizations with a commitment to racial justice, organizations that are person-centered and non-punitive approaches to drug use, and also just kind of making sure to highlight that you don't need to have a work history of engagement activities related to substance use. So we're open to applications from organizations working in adjacent fields. So people should really think very creatively about how they might be able to integrate harm reduction into their work. Next slide. Excuse me. So project guidelines. So proposals should promote health-based harm reduction approaches to drug use, address inequity caused by racism and poverty, address unequal access to naloxone, medications for opioid use disorder, or certainly other harm reduction interventions. They should address stigma towards people who use drugs, address increasing Black maternal mortality, address lack of treatment options for people who use stimulants. So all of these are just kind of ideas. They certainly don't need to address all of these at once. And just a note that this is a one-time funding opportunity and that it's not intended to support research projects. We're going to give some examples. So some ideas that have been used in the past, disseminating safer drug use supplies, so test strips, naloxone, wound care kits, safer sex kits, hygiene kits, menstruation kits, in-house Hep C, HIV, STI, or pregnancy testing, services to support family preservation, low barrier services, so things like housing, medical care, case management, linkage to employment, and adding in here much more because again, creativity is key here. It can mean a lot of different things. Next slide. So at Vital Strategies, we have done similar RFPs just in Philadelphia County, Michigan, and New Jersey. So I wanted to provide some examples of projects that have been done in those other states and in Philadelphia to kind of make it a bit more concrete. So some examples in Michigan, we funded Detroit Action, which is a grassroots member-led union of Black and brown, low and no income, homeless, or housing insecure Detroiters fighting for housing and economic justice. Their proposal included them developing harm reduction advocacy capacity through story collection, media, voter registration, advocacy, and base building activities. Another project was the Metropolitan Organizing Strategy Enabling Strength, or MOSES, which is an interfaith organization expanding focus to train organizers with lived experience with substance use to organize and hold listening sessions in the community to inform and develop recommendations for political leaders and lawmakers. And lastly, in Michigan, we funded Abundant Community Recovery Services, which is a recovery-oriented services provider, which expanded mobile harm reduction unit services and access to peer recovery coaches in BIPOC communities. We can go next to Philadelphia. In Philadelphia, we funded TRAP, Taking Risks and Prospering, which was a small organization providing outreach to people who use drugs, sell drugs, and caretakers impacted by the war on drugs to develop and disseminate harm reduction strategies. They provided stipends to unhoused individuals who were conducting outreach. They developed a blueprint for community care. So it was educational materials informed by people with firsthand experience in harm reduction. And they did tabling events, and TRAP is an excellent example of a sustainable program. The city's health department saw how valuable TRAP's work was in the community and agreed to create a full-time position, which has now ballooned into a team of 6 with support from Vital Strategies, the City of Philadelphia, and the state's Department of Drug and Alcohol Programs. And we can go next to New Jersey. So in New Jersey, this is an example of 3 projects that were funded. The first being Ruby's Vision, which is a resource center for people experiencing or who are at risk of homelessness, incorporating harm reduction focused outreach. So Ruby's Vision was originally founded as a resource center for women and children who were experiencing homelessness or at risk of losing their housing. And through referrals and outreach, Ruby would provide connections to new housing opportunities. And since receiving Vital Strategies grant funding, she's integrated harm reduction services into her programming and has begun providing harm reduction focused outreach within the city. And she's also working to become a certified harm reduction center in New Jersey. We also funded Proceed Inc., which is a health and wellness program offering HIV service, expanding HIV services. And they expanded to include harm reduction outreach, and they're working towards offering more comprehensive healthcare services. So they've historically offered HIV services and substance use programming, but since receiving funding from Vital, they've expanded to include harm reduction. They've become a certified harm reduction center in New Jersey, and they're currently applying to sustainable harm reduction funding through the state in hopes to integrate more comprehensive healthcare into their harm reduction work. And last but not least is Chosen Generation Community Coalition, which is an outpatient recovery faith-based program that prior to funding from Vital Strategies didn't offer any harm reduction services at all. And since our partnership, they've begun outreach to local hotspots within their city. They've connected with community members who use drugs to disseminate supplies and offer support. And they also have recently been approved to be a certified harm reduction center in New Jersey. So these are all really great examples of how some seed money has really propelled these groups forward in harm reduction. And now we will pass it over to Scattergood to start talking about subgrantee expectations.
Great, thank you so much. And I just want to note we do see the questions coming through in the chat. I believe Dana is responding to some, and we will definitely get to questions and answers at the end. Do you want to do swap displays? Awesome. So one of the pieces that we'll be providing through this grant, so we'll be funding up to 9 organizations, and we'll be building a grantee cohort from those organizations with opportunities for capacity building and TA. So organizations will have access to up to 6 hours of collective sessions for the grantee cohorts, and those sessions would be 2 hours each. And then optional office hours and individualized consultation as needed and if desired. We haven't yet decided on topics for those consultation sessions and really plan to work together with the grantee cohort to identify the areas of interest, and really wanting to make sure that the capacity building opportunities are appropriate and feel like are useful to the grantees, and a good use of their time. So really hoping to kind of go beyond the grant dollars to ensure that organizations have what they need in terms of other skills and knowledge that they feel like they could have access to through this opportunity. Next slide. Great. So for reporting requirements, we're going to be accepting reports at the mid-year mark and then at the final report stage. So once the grant program is completed, and we'll want to know some information about communities you served through the grant, program activities that were completed, the number of individuals you served, and the progress that you made towards your desired outcomes that you identified in your application, as well as any challenges, reflections, and lessons along the way. We also will want some brief information about how your organization spent their funds. I'll pass it over to Bridget to give us a Foundant walkthrough.
Thanks, Caitlin. Hi, everyone. And so Foundant is the name of the Scattergood Foundation online grant portal, which is how you'll probably be seeing it. And we're just going to step through that process. You can access the Reach PA application two ways, either through the Scattergood Foundation website, and the address is there, or the Scattergood Foundation online grant portal. If you do wind up using the Scattergood Foundation's website, you'll first want to navigate to support, which you'll see boxed in red. You'd go to special grant programs, and underneath that, you'll find the Reach PA button. On the Reach PA page, there's an overview. There'll be the full RFP, FAQs, a lot of things you need to get information on this application. And then at the very bottom of the page on the left-hand side, you'll see the Apply Now button. So if you navigate to the online grant portal, you'd find yourself at the logon page. And on the right-hand side, you'll see directions for new users and for existing users. If you happen to be an existing user, you will enter your email address and password and log on, but a new user is going to have to create a new account. Creating a new account, you give your user information and then enter organization information as well. And we just wanted to highlight that an EIN and tax ID is required. So if you are a fiscally sponsored organization and do not have an EIN or tax ID, just reach out to Scattergood to discuss how you and your fiscal sponsor, if you have one, will work together to submit this application. One way that so if you want to apply on our grants portal, there's the apply button in blue on the right. You'll click that. And this is the application page. You'll see here up in the left-hand corner, there's a select language button with a drop-down menu if you need translation of any of this. Google Translate provides that. I'm also just noting that there's the due date, and fields with an asterisk are going to be required. This is what the application looks like, just a little teaser there. There are 2 uploads required for this application, and one of them is a project work plan. So the project work plan, we have included an example, which is an Appendix E of the full request for proposals on the Scattergood Foundation's website. So hitting that blue link will take you back to the website to just give you a sense of what that is. And once you have your own work plan created, you would upload, hitting that gray button that says upload a file. And this is Appendix E of the sample work plan. And we just want to note that this is only a sample work plan. It's not a directive. Yours does not have to look like this, but it might be, we thought it would be helpful to have an example. A budget is also required, and we do ask that you use the budget template that has been developed for this application. The blue button will take you to that template, which can be filled out. And again, you'd hit the upload file when it's finished. So this is an overview of tab 1, which is the budget summary, and it has various budget categories and the amount that will be spent in each. The next tab is budget detail. And you would just provide more information on the categories that are listed in the budget summary. So here you see personnel, and there's staff, could be like a position title, how much that would cost, salary, etc. And the save and submit application button's very important. So as you're working, you can save your application using the gray save application button. And when you're ready to submit, there's the blue button in the right for submit application. That is all for me for the Found It walkthrough.
Yeah, so we're going to move on to some questions and answers. There's been a bunch of questions and answers already in the chat. But if anybody has a question that they would like to answer, and then we can also go through the chat and kind of verbalize some of the things that have been asked already to see if there's any further questions. Happy to answer any and all. All right, so why don't we take a look at some of the questions from the chat. Our applications only open in Philadelphia. So this application is open statewide. Everybody across the state should feel free to apply. Organizations of all sizes are welcome to apply. So the application will prompt to ask about your annual budget and the size of your organization, but you are free to apply even if you're a larger organization or even if you're just a single person doing this work. There were some questions about specific eligibility requirements, whether primary care offices or health systems would be eligible, and the answer to that is yes, absolutely. If you have specific questions about your situation that you want to ask before you start filling out the application, you can always reach out to us and we're happy to talk with you. Board membership does count towards BIPOC leadership, so feel free to send in an application. Does the project have to be a new program or at an organization, or can it be a current service? So yes, feel free to apply if you're already offering harm reduction services. There were some questions around for organizations that are not currently collecting demographic data on those that they serve. So I just put in there that the application prompts for demographic information, but Caitlin or Bridget, if anybody at Scattergood wants to speak to reporting requirements a little bit more, if you have more information to add to that.
Yeah, I think, for reporting requirements, I think we just want to get a general sense of the folks that you're serving. It can be the location. We tend to also ask about community assets and what are the strengths of your community beyond just sort of those basic demographics. But really, I think we are thinking about the reporting structure as more open-ended and really giving you all the opportunity to speak to your programming from your point of view.
Thanks, Caitlin. Yeah, and Victoria just asked that I mentioned that this is a statewide grant and asked whether it was linked to state government. So no, this is not linked to state government or government funding. This is fully funding from Vital Strategies with support from Scattergood Foundation. Good question. So Eliza just asked, how are we defining harm reduction services? Does it have to be drug related, or can it be other challenges in the community be addressed as well? Great question. I'm really glad that you asked it, because we are thinking about harm reduction as community support. So no, it does not have to necessarily be drug related. It can be other supports to communities. So when we talked a little bit about, services that support things like family preservation or housing support, we want you to think creatively about what that means. So does not necessarily have to be drug related. Would be interested in hearing what that means for you. Anything else to add, Scattergood? Okay.
Nothing to add. That's great.
And Paula asked, can we use this grant to augment an existing program by providing training to current workers? Yes, you could do that. if you have questions about what you're specifically thinking about that you would like to ask us beforehand, you can feel free to reach out. We will share all of our contact information, and you can feel free to email us if you have a specific question. Any other questions? If there's not other questions, I think that, we can hang around. Scattergood and Vital can hang around here for a little while. If folks want to drop off because they've had their questions answered, that's great, but we can stick around for a bit in case people hop on or, thank you. In case people want to hop on later, or if you have questions that you want to ask, we can hang on here, but otherwise, we appreciate you taking the time to come today and to hear a little bit more about the grant. We really hope to see applications from you all, and just, a reminder that we are here to help support. So if you are logging into Foundant and you realize that you need some help or you want somebody to help walk you through it, we are here and ready to help you all. So don't hesitate to reach out and let us know. And Scattergood, when will the recording be posted?
We certainly by tomorrow at the latest. And we will send out in follow-up as we'll post the slides and send them out as follow-up as well.
And we'll also put together a Q&A document just based on the questions that were asked today. And
Helen?
Helen.
Hi, my question was addressed in the chat kind of, but I just want some clarification. So if you're an organization that does not collect demographic data from participants, I guess will that be a knock against us in the application if we have estimations of the people we the demographics of the people we serve, but then we are able to maybe collect some of that information in preparation for reporting? Does that make sense?
Yeah, I can try to take that. It will not be taken as a knock against you. I think, in particular for smaller, more grassroots organizations, it can be a challenge to be constantly collecting information when you don't have as much of that infrastructure. And the way the questions are kind of structured in the application are pretty your best guess. And, getting a sense of sort of your estimation of who you're serving.
Okay.
Connection to that community, really.
Okay, cool. Thank you.
Absolutely.
Sharon asked, sorry.
No, go for it.
Can the funding be used to support community health workers? Yes.
And then
Okay.
I see Kasim asked about if your organization has a fiscal sponsor or fiscal agent, will that preclude them from eligibility? The answer is no, and we'll make sure that's very clear. Organizations with a fiscal sponsor can absolutely apply. And if there is a group, a mutual aid group, or a different kind of organization that doesn't have 501c3 status or a fiscal sponsor, please reach out to us and we'll figure it out. We want organizations to feel like they can apply.
We really want to try to be as low barrier and open as possible. So if you have any question about whether you're eligible, especially around the 501c3 or fiscal sponsorship, please just reach out to us, because we'll want to talk with you about that and see what we can make happen. Any other questions? Or for folks that are joining us now, you can also feel free to ask any questions that you might have. We have a whole other half hour dedicated to this, so we're more than happy to to talk anybody through it. But you can also feel free to head out if you're all set. So Laura asked, do you recommend being more specific and restricted requests, or can general operating be accepted? You don't need to be super specific. I would recommend, applying. I think it's super dependent on the type of work that you're doing, but I mean, I think if it seems like it fits into this RFP, yeah, I would submit. Sharon asked about when they're formatting questions, are bullet points okay? Yes, absolutely. We don't want folks to feel like they have to write a dissertation for this application. So bullet points are welcome. We've allotted quite a bit of space for people that want to include a lot of information, but it is certainly not necessary. You can feel free to be concise and use bullet points. Any other questions from folks here? I'll include Dana and my contact information in here. Feel free to reach out. What do you think, Scattergood? Does anybody else on the call have any other questions?
And I just dropped the Scattergood team's information in the chat.
Yeah, thank you all so much for coming and for participating. There are a lot of really great questions people have brought up, and don't hesitate to reach out with us with any more.
Thank you for having us.
Yeah,
Thank you.
Sorry,
Thank you.
totally
for coming.
casual today. I didn't want to come on camera.
Oh, it's all good. It's all good. This is casual. Yeah, and if you hang up from this call and you have a question immediately, you have 5 people that you can reach out to with any questions, and don't hesitate.